Welcome to the Private Practice Podcast. Today we are joined with Emily, who is a sports rehabilitator. My name's Sarah Jane Walls and I am your host. Now, Emily has literally just graduated as a sports rehabilitator, and many of you watching this might be thinking, what is a sports rehabilitator? Emily's been working with us here in the Hub Glasgow for probably nearly a year now. It must be, while you were still doing your degree. But I suppose let's start off, Emily, just talking about what is a sports rehabilitator?
So we essentially specialise in MSK injuries and like muscle, tendon, joints, things like that. So we essentially assess like the patient when they come in, try and come to a diagnosis of what's sort of going on, and then help rehabilitate their injuries, whether it's through like a specialised rehabilitation programme, refer them on for ultrasound for more information, or up in the clinic we can use things like laser therapy, along with sort of a specialised rehabilitation programme just to help them get back to what they loved doing.
I suppose it's an interesting one, right? Because listening to that, it sounds like a physio, doesn't it? What in your words, when you're thinking about it, what is the main difference between what you do and what a physiotherapist does?
We specialise in MSK, so physios, they can work, well, we obviously get MSK physios and things like that, but we have 4 years essentially focused in on MSK and rehabilitation, so we have just like a really in-depth knowledge into like patient-centred and just really focused in on
MSK
rehabilitation, strengthening them up, and just making it a really personalised rehabilitation journey to them. So like I say, physio can do that too, but we have like just 4 years specialised just in that area, whereas physios can sort of dip into.
They've got lots of modules from respiratory to neurological, all of the different bits that physio will do. So what I'm hearing there is that your degree specialises specifically in musculoskeletal health and rehabilitation. And then your governing body, talk to us a wee bit about that, because as a physiotherapist that work here and myself as a podiatrist, we have, I'll need to cut this out, can we not talk just out? Sorry.
Okay, cool.
Sorry, we're doing a podcast. No, unless it's something you really needed. So essentially, if you were, I suppose with us, we are healthcare professionals and we're regulated via the Healthcare Professional Council. What is your profession regulated with?
So ours is called Bas Rat, so it's essentially the British Association of Sports Rehabilitators. So it is very similar to like what you was sort of under, just like specifically for sports rehabilitation. So that's who would be like insured under. We can do like CPD, things like that, all through them. And it's essentially just like the gold standard for who you want to be registered under. For sports rehabilitators have like courses that are recognised within. So Queen Margaret University, we were like a course that was recognised by them, but you need to do like a entry exam to make sure that they're happy with the standard that they want for a sports rehabilitator.
So essentially you do a 4-year degree, and prior to that you did sports therapy, didn't you?
Yeah, so we done 2 years at City of Glasgow College studying sports therapy. So that was essentially like sort of like initial assessments, like acute injuries, things like that, some like hands-on therapy, and then you could do a further 2 years that was tied in with Queen Margaret University. And so essentially like 3rd and 4th year of uni, which was just more focused into sort of rehabilitation, more longer term, getting the patient back to what they love in their.
And it doesn't need to be a sports person, doesn't it? You work with anybody. We'll get into that in a wee minute. Right, I suppose my next question is, what made you, Emily, tell us a wee bit about you, what made you choose to become a sports rehabilitator? How did you end up here?
So I've always been like interested in like sports and fitness and things like that, and just seeing like people growing up in like the sort of sport environment, there was always injuries and things like that, and it was just really interesting to see people come from thinking that they can never go back to doing what they love to then eventually being able to go back, and sometimes even better than before. You also just get like a sense of like satisfaction from being able to help someone like right through from immediate injury to returning back to what they love. It's just really rewarding as well, just being able to.
You're quite sporty yourself, aren't you? You love all that. And I suppose we touched on this, but I think when you hear, as members of the public, maybe watching this podcast, sports rehabilitator, you immediately think of a sports person, don't you? So tell me about the types of people you work with, Emily.
Yeah, so the name can be quite misleading because people do initially think that it's only for athletes or gym goers, but yeah, we can see pretty much everyone from like young athletes to just elderly people trying to get out their day-to-day life, because it is very much we treat each patient as an individual. It's not like a one-size-fits-all sort of treatment. We come in, get like a full history of the patient, what's going on, and then we assess them, basically create like a treatment plan specific to that individual in front. So yeah, it just allows us to treat anyone that's got any MSK sort of issues in front of us.
So the other question I'm going to chuck in here, right, is thinking about the difference, because members of the public, it's so hard when you're in pain or you've got an injury. Who do I go to? Do I go to the physio? Do I go to the podiatrist? Do I go to whoever it is, sports rehab? I need a personal trainer. There's so much. It's confusing though. I suppose actually when I'm looking at this question, right, I've got here, what's the difference between a sports rehabilitator, physiotherapy, personal training and massage therapy? Because you do a lot of them that crosses over. To be honest, you could probably have put that hat on again, like a sports rehab. You've got that. From a sports therapist, you've got that. To personal training, a client, you technically could do that. To a massage therapist, you've got all those soft tissue skills as well. But I think what you're saying there is that difference between, you're looking at the patient individually, you're getting a whole management plan in place. You can use any of those skills. Yeah. You've got all of those skills all inside that sports rehabilitator. Would that be a kind of, it's no one thing or the other?
That's pretty much what you're saying. It sort of feeds into each other. And I think also, the good thing about this clinic here is that we have a mix of sort of all of them. We've got the sports therapists, we've got the physios, like the
one person.
So they don't have to deal with me the full time or deal with just like the physio man. So it's very much we can all jump in and help each other. So it's quite good if they come to somewhere that does have sort of
lots of different skills
and have the skills.
Because we all have very different ways of thinking about things, don't we? It's I suppose the way you would describe that would be like a multi-disciplinary team. And it's a really great way to work, I think, in MSK, but in anything case specifically, because if you've got your own specialisms and your own things, and everybody goes deeper into certain areas, so that person might be able to do something like a surgical procedure that person needs, or they might need a scan. You might be like, actually, there's something a bit funky going on here. Sarah Jane, could you scan that? Or man, say, do you want to I need to chew the fat with you over this. So you want to chat to the physio about something. And then they might need a bit of sports therapy in there as well, so you can work with the other sports therapists, and it's quite nice to have that. Right. I think that you've answered some of these ones here, like where does sports rehabilitation fit into recovering? And because it's part of that, isn't it? Yeah. It's not any different really to what a physio would do there.
It is very, very similar to the physio.
This has been a big part. So Emily's worked with us here at the Hub for the last year while she was doing her degree, because she was already a qualified sports therapist. She's already also recently done her Pilates training and really enjoyed doing well with that. One of our big things is to get you integrated in here to really own your own patient group, kind of like what we've done with Mancy and the physio. So in your ideal world, just I'm putting her on the spot here, right? In your ideal world, what would be like your perfect patients? What would that first assessment look like for you? Would it be different or would it be pretty similar? What would you say?
I'd say probably pretty similar. Yeah, I think well, we were having a conversation before about almost creating a better patient pathway, because I feel like just now we're very much it's home care rehabilitation, just because we don't have the rehab sort of side in-house, just sort of building up to having a bit more like one-to-one time just with the clients, doing the rehab, making sure that they're doing their exercises properly, and just because we can do that, but it's just very limited to what we can do in here just now. So yes, we only really have up that better, like patient progression through the clinic inside, like in-house.
And what we were discussing was like strength training and bringing in some more, I suppose, hardcore strength stuff. So because we only have our Pilates
we can do
side.
The Pilates downside, or downstairs, to help with like strengthening and things like that. But just getting them in and really pushing their limits.
Pushing them a bit harder. Sorry, people, she wants to So that's probably where, well, it's not probably, it's where we're going with that here and how we're integrating Emily's sports rehabilitation degree into the clinic, because this degree's really new, isn't it?
Yeah,
So
there's not
new.
much up here as more
Down south.
down south, yeah, more physios and things like that that are sort of out in the industry up here. But yeah,
So it's called a sports rehabilitator. And I think the other problem I see with that from a public perspective is that's probably not a protected title. So you could probably have somebody who had done not the extent of training that you've done, and they could probably call themselves the same thing. Would that be accurate?
yeah.
Right. So that's, aye, it's a wee bit annoying, that, isn't it? And that's a wee
I
bit.
think the good thing though is that if you are, obviously we talked about Bas Rat earlier on, so
Yeah.
they are like the gold standard. Like I say, you have to do a course that's sort of they recognise as sort of up to standard for what
And
they're
then you
looking
then
for,
sit the
and
exam.
then you have to sit like your entry exam. So just having like looking out for that sort of association does sort of help.
So what's that called? Bas Rat?
Yeah, so
Like
it's
rat?
yeah, so and it's British Association of Sports Rehabilitators.
Right.
And like I say, they're sort of the gold standard like association in the industry, and you know that you're getting someone that has done like a good course, and like I say, they've done the exam to get into it is what they're looking at.
So for any members of the public, they should just do a wee bit of due diligence in who you're working with, and, you know, have they done something credible? Because you could simply do a weekend course, couldn't you? And call yourself whatever you like. That's a wee bit scary, really. But if you sitting in this chair now, 4 years after your degree, if you had to have somebody who'd maybe done a couple of weekend courses and claiming to do the same sort of thing that you're able to do, how do you feel about that?
I think it's similar to the like Pilates as well. Anyone can go and do like a weekend course and say they're the Pilates instructor. It's quite scary that people, I think it's more just getting the message out there to the public of just do your research into what the person's done, who they are, how much have they sort of put into getting the qualification or getting the title that they say that they are. Has it just been like a weekend course, and just sort of how credible are courses and things like that they've done. Yeah, it's quite
So
quite hard.
if they're associated with one of these like Bas Rat or for us it's a bit easier because we have like what's called a protected title, so you can't call yourself that legally if you're not on the register, so to speak. Same as like you couldn't call yourself a dentist, or you couldn't call yourself a doctor. So it's maybe that's where things will go. There will be some sort of title that will be protected, to just so that, because it really is that public being protected from just cowboys, people that are just being a bit naughty. Moving on to something a wee bit more productive, useful stuff. What is the biggest mistake that people make when they get injured?
I would say probably the most common is, well, there's sort of kind of contradict each other. One of the main ones is people think, oh, when I'm injured, you need to immediately rest. It's can actually sometimes, more often than not, worse for your injury because it can prolong the healing, things like that. But also other people then have the issue of they like to ignore their symptoms, come back too quickly, like that. So it's just either not progressing enough and thinking complete rest, your symptoms will disappear and you'll be fine to go back, or ignoring their symptoms and just trying to rush back. I would say they're the two most. So that is, it's so hard then, isn't it? You really just need to seek help, don't you? Go to see a professional if you've got an injury, and it's, to be honest, I would say just go right away. As much I would, because your outcomes will be so much better. Well, you're seeing a professional, they're going to get the right diagnosis to what it is and get you on a proper plan that's going to get you much better results. Like, is rest always the right thing to do if it hurts? Say it's hurting. Somebody's coming to you, Emily, and they're saying, but it's really sore when I do that, Emily. It depends how much it's hurting. It isn't always a bad thing. You've been hanging around with me too long. If we want rehab most of the time, you do want a little bit of pain. That's how much is that pain? What kind of pain is it? Knowing your limits and knowing what's a good kind of pain, what's a bad kind of pain. And like I say, because it's such a personalised like journey that you get taken on with your clinician, they'll be able to guide you through it, which is why, like you were saying, you're better going and seeing a professional about it, because they know what to look out for rather than you either pushing through the wrong kind of pain or just going back completely and not seeing that progression and not
She
pursuing it.
basically didn't answer this question again, people. Basically, there is no right answer to that. Sometimes pain is a bad thing. Sometimes actually, well, in most rehab, it will be a bit uncomfortable, and it's knowing the difference between what normal and what isn't is. Right? Here's a good one, because this happens. Do some injuries keep coming back even after the pain settles? Done the rehab, you have been amazing, and then that.
Once again, I think quite a vague answer of there's no one right answer
Really?
on it. Yeah, quite often people think that once they've done the rehab and done their pain free, they can go back to what they were doing before, but it's quite often you need to keep up some sort of like program for essentially you can call it prehab, so preventing the need for rehab, and just making sure that you're keeping on top of like your strength, like just your movement, things like that, just not going from 0 to 100 and thinking that that's you completely good and you're able to train again like you were before. Just essentially keeping on top of.
Okay. So keep on top of things, don't just think because the pain's away, you're all grand and you can just get back to it. You just need to be on it.
Yeah.
And sometimes if you've done a wee bit of injury there, you're always just going to have to work a wee bit more. I always kind of joke and say it's like, especially as they get older, like you're like a classic car. You just need a wee bit more maintenance.
Yes.
You just need to look after yourself a wee bit, and it needs a wee bit of boiling up before you get going. So yeah, a wee bit of a longer warm up. Right. Now, let's talk a wee bit about load management. What does load management mean in plain English? What? Because sometimes people hear, you need to manage the load that you're putting through that. What are we talking about?
Yeah, so essentially it's just
A simple way to
explain it, yeah. It's so hard to think of.
Yeah, so it's about thinking about like if you've got an injury and you generally do what you optimally load it, right? So I suppose the key here is optimally loading, and there's another term. What does that mean? So for example, kind of immediately my head went to when I ruptured my Achilles, which is not a nice injury. What you want to do with any injury is to put load through it at the right time, isn't it? It's that loading it at the right time, and then optimally loading is only putting enough load through that tissue is able to deal with the response when it's injured. So it's hard to kind of verbalise that, isn't it? So essentially it's the right load at the right time for the right amount of force going through it for that person, depending on what they need. And then you're then increasing that load as that tissue is able to then deal with that load that's going through it. So you're optimally loading it. But, right, okay. And if someone's been told just to strengthen it, why might that not be enough? So if you're somebody like come into you and said, yeah, I've been told I've just to strengthen it up, it's not good enough, is it?
No. There's so much more to an injury or like anything than just strengthening up, like mobilities, all sorts of things, and just essentially you need to treat the injury as a whole, not just there might be a lack of strength, but what else is contributing to that lack of strength. Yeah, you just need to look at it as a whole and treat the injury from all angles rather than just focusing on one sort of modality, because you're not going to get back to where you were before with just focusing on one modality such as strength and thinking that that's going to be the magic cure for it. You need to, like I say, take it from all angles and build it up.
Also, I think as well, why did it happen in the first place? Why, maybe it has been an acute injury or something's happened on the pitch or whatever, or you've just went over your ankle or something's happened. But sometimes it's almost like a ticking time bomb because you've got something going on that you've not dealt with. That you're then now life with this injury or problem. If you just always do what you've always done, you'll always get what you've always got. So you have to do something different. Confidence. What role does confidence play in getting back to sport, normal daily activities after you've had an injury or maybe a fall? It could be anything, couldn't it? I immediately think of some of my patients upstairs who, especially as they get older, it's almost like insidiously their independence is stolen away one wee tiny driplet a day. And you see it, and they just have that wee fall that gives them the fright of their life, and then they avoid doing whatever it was they were doing, and then they slowly get weaker and their balance starts to go and they become more of a false risk, and actually their life then gets smaller. They start not to make decisions to do things that they used to do. Everything's overthought. What if I'm doing it? Oh, the weather's bad. Oh, what if so to me, this thinking just the language we use and how we get people feeling confident in their ability to be able to do the normal things that they do. Let's hear your thoughts on confidence in returning and trusting an injury after sport. Can I, say somebody's ruptured their Achilles, they've done something bad, right? And then they're really frightened about going back on whatever it is, tennis or whatever it was they were doing. What kind of stuff would you be saying to them?
Yeah, so confidence obviously is a massive thing that help prevent people get back to their full potential post injury. Essentially is just like say we treat the injury as a whole, so we're not just they might tick off all the physical markers for being ready to return, but they just essentially have a mental block. So it's just essentially reassuring the patient that they are ready to return on the progression that they've been through, and if we need to strip it back and maybe just gradually return them for the warm up and then the warm up and maybe some redrills, things like that. It's just making sure that they're going through that gradual progression that's sort of at the right stage for them to get them back to potential. So it might be slower than someone else, but like say you treat it as a whole, as an individual, as a whole. Like say they might be ticking all the sort of physical markers, but if they're not mentally there, asking them questions of why is that, where's the fear coming from, and essentially just talking them through just helping with that fear and talking them through how they're ready and
giving them that confidence, testing it and giving them, look, actually it didn't start, you're fine. And I suppose with that as well, it's individual, isn't it? Different people respond to different things and you need to have different conversations with different people. Somebody who's maybe an athlete, you're probably pulling them back. It's probably a different conversation you're having because they're usually desperate to get back. It's a very individual. It's not really a sweeping statement. Where do you think sports rehabilitation fits within a wider MSK team, so a musculoskeletal health team? Where do you think your role sits, Emily? There's a question.
I think it's for example, in the clinic, we've obviously got you online things like that for training sort of an MSK or on users as well with her physio and things like that is essentially just feeding off of each other. I say I've done 4 years specifically in MSK rehab, things like that. So just bouncing ideas off of each other if anyone's sort of stuck on progression, things like that. Isn't everyone's knowledge to the patient's advantage, essentially? It really does say. If no one knows everything, so it's just helping each other out, essentially, and collaborating together. And
I suppose this, but you take all sorts of patients, don't you? It's not just sports people, it's anybody. And I suppose I think we should talk a wee bit about the communication and things that we do in here. We don't always get it right. I think that one of the things we try and do in here is usually, and this will be something Emily will step into with her newly graduate, she'll have her own patient load you've never really had. You don't really ever see anybody for a first appointment. It's I'm not allowed to see them for a first appointment. And so that will usually be a more senior clinician that will see somebody for a first appointment, because there's lots that happens in that first appointment and you usually can be involved in it. But you'll usually see them for reviews once all the kind of things are in place. So that first appointment can be quite complex because it can include a diagnostic ultrasound, it can include a gait assessment, it can include a kind of thorough MSK assessment, depending on, it just depends on what's going on with them, doesn't it? And then the whole management plan's built out from that. So we build out a full plan. So what do they need? They need strength and rehabilitation. And this is definitely a big, strong point we'll be pulling you in for. And they also might be needing a course of something, shockwave therapy, laser therapy, or some sort of surgical intervention, or whatever it is, right? So there's all these bits to it. And then the communication to the patient. So they get a letter where they have to, that then outlines what's going to happen. And then their GP will usually get a letter telling the GP what we're up to and what's happening with that patient as well. And then maybe any referrals on to, maybe they need some stuff from the pharmacy. So it may do, prescription requests for different medication. So it's quite a lot. That first appointment is heavy. So it's where, I suppose, where we see you come into that is managing your own patients, where you'll be able to pick a big bit of that up. Now there'll be bits of that where it'll be medication review or a diagnostic ultrasound scan, you'll be like, right, that's that clinician that deals with that. So that person do that, but I'm going to slot into the rehab. So what we might do is in that first appointment, if somebody needs specific rehab, it might just be that they always just come to you for that, and we don't then get involved in that. We just say, right, Emily, this is the issue. This is now your problem. Yay! But it's slotting that in. I think that it's interesting. I think if you're a clinician watching this or a patient, these are the sorts of things that happens behind the scenes in a clinic. It's like, how do we best give the patient what they need and use the resources like Emily's expertise with the rehabilitation to the best of your abilities. One, you're not overburdened, but it's allowing that patient to get the advantage of that, and that you're then managing that, and then seeing them probably a bit more often than what we would. So I think that's probably how they will run it. Sound like a plan? She's like, okay, we'll give it a go. Right. So in here, communication, we use clinical, don't we? We've got notes and things on there, and we write letters and stuff to the patient. So we usually leave with something printed out. If there's something problematic, you're usually in. So we usually just drag you into the room. So that's how we communicate. You just drag into the room. If, right, this is Emily, she's going to help with this. That's how that would usually work. Or you would just read the notes, you on the file. And then we have our Slack channel, I suppose, if there's something we really need to get in for. Right. So tell us a wee bit about what you've been up to about Hub. So we're going to move on. So what have you been up to this last year? What kind of things have you done?
So started off obviously with placement, like we said. That was very much started off sort of shadowing all sorts of different treatments, podiatry focused, as well as some physio, some sports, things like that. Just sort of getting an idea of what everyone's role was in the clinic, and then went into some more hands-on. So it was sort of more down sports therapy route of like massage, get trains up on like shockwave, laser therapy, things like that. And then just sort of progress more into my role and my degree as like the longer sort of been here. And then we also done the clinical Pilates training as well. So that also feeds into sort of my role as a
massively does, doesn't it?
And started doing some like Pilates classes, some tower classes, things like that. So just really building into like my role as like a rehabilitator, working in with everyone else and their roles in the clinic, and
it's like feeding
into the Pilates side of it as well.
And that was totally new to you, wasn't it? You really have been like a bit of a duck to water with that, because I think you started that, I can't remember when your first course was, when we put you through your Pilates training. And you've done a few, haven't you? You do lots of CPD, don't you? You've been doing tons. And I know Faith, the studio manager, has done a lot of work with you as well. And I think you do your monthly CPD with Faith. I think, would I be right in saying you kind of helped team teach, didn't you, on the latest course? You taught a little bit on that. How did that feel?
It was good, It was definitely, like you say, not something that I ever thought I would be doing before I came here, but it was really, really good. And definitely, because I'm still learning, it was good to like listen
again,
you going through the course again and helping build on like my teaching style, things like that. And then it was also just nice to just go and teach a class start to finish with other people that are in the same boat as you. They're starting out learning, eager to teach Pilates in a safe thing.
I suppose what I would say is think about how far you've come. I remember sitting watching you on Friday. Actually, WhatsApp Faith, the studio manager, while you were teaching, and well done. Emily, I'm just sitting watching Emily, and my goodness, like it's lovely to watch. There's lots of beautiful cues coming out. There's just a lot of imagery. And if I remember back, I mean, if you even think back to when you were first on that first course, what it felt like to stand up and just teach even your peers, and how different that felt, to last week when you were teaching to those up and coming teachers, where you have progressed beyond that. They're coming through as well, but you are beyond where they are. And, you must.
It was so different from that to when I was on the course, because like I say, it wasn't something that I ever really thought that that's what I was going to do. And like you're saying, going up and teaching in front of people that do have sort of a rough idea of what Pilates is and
Well, it's easier to
teaching
move a
things like
board
that.
and
It's not, in a way, you're
Yeah.
there's not, it's much easier to teach an experienced lot of people than it is to teach a beginner. But yeah, it was really intimidating standing up in front of people for the first time. I haven't done it before. And then, yeah, let's say, because we've had the practice and started teaching my own classes as well, it was a lot more natural standing up in front of them.
Yeah, it's such a skill to have, isn't it? And so I think the next stage, which is lovely, is that building, because you've got that now, that underpinning of the Pilates method, you're then able to take that into your rehab, which is a fabulous gift to give your clients, and be able to work with injuries and take bits of the method that work.
That's why I was so keen to when you suggested it. Like, I'm a straight
Absolutely.
I'll definitely go on and do the training, because through uni and college it was always a thing of people were starting to refer people into doing Pilates, things like that, just because it does help with obviously your strengthening, your movement, just helping your body move a bit better. It's somewhat more likely to stick to it through the Pilates class rather than if you send them just on their own.
It's just that community, and you've got a bit of peer group community.
So getting that sort of extra knowledge behind me into the Pilates method, it was so much easier to refer clients on to going down that pathway rather than telling them to go down it, and I had no sort of knowledge.
You're just
to back up.
Posting them, go find a wee Pilates class somewhere, and they're like, I don't know, and you're now able to take them yourself, or to send them to some of your colleagues. It's a lovely gift to have, genuinely, and your clients, it will be something that will live with you forever. So you do lots of things here, right? So from Pilates to, you might be doing shockwave therapy one minute, you might be doing a sports massage, you might be doing a clinical assessment, you might be doing laser, you might be mopping the studio, because we all have to do that. And it's quite a varied, I see it was a varied role, isn't it, working in a busy clinic. Suppose my kind of bringing this to a wee bit more of a close, what patients do you like working with the most? What's your favourite type of patient?
I wouldn't say there was like a type demographic, just someone that's keen to get better and is
engaged.
Open to stick and sort of the rehab plan and listen to your ideas and really take on board all the advice that they're going through. And like I say, because in here it's so varied, I quite like no two people that walk through the door are the same. As long as someone...
It's quite stressful though, is it not?
Yeah.
You're not bored, you're always like, you're always in high stress.
But yeah, just someone that's engaged and wanting to get better, and just happy to go along with the advice and ask the questions if they're not sure. Just someone that's
somebody that's engaged. It's difficult to work with people that
want just a quick fix, and that's...
it's very difficult. You've got a lot of people that think, I'll just do one manipulation, I'll just do one movement, I'll do, as soon as I do this rehab once, that'll be it, it's fixed. And it's very difficult to get results from those kind of patients. Myths we want to challenge. So I've got down here, sports rehabilitation is only for athletes. Not the case. Rest fixes most injuries. No,
often it's
the opposite. It's very rare to hear me telling people to rest, isn't it? Like, get up, move, stop, rest. You've done resting. Pain always means damage. No. And a scan is always needed before rehab can start. No. Rehab has to hurt to work. Oh, sometimes we just, no, I'm joking. It doesn't need to, does it? No. And then once the pain is gone, the problem is fixed. So... Is that helping everybody? A bit of prehab, as Emily was saying. And then I'm going to, because obviously you graduated yesterday, congratulations, and your dress was lovely. You look so good.
It was actually one that was just up the law.
Really?
The dress never came, so it was one that already had.
No! Oh, it looked amazing. What were you wearing in your feet?
Just these small
like heels. Because I was like, she's got on quite sensible shoes. Very good.
I was like, I knew if they were going to be any higher, I'd feel like paranoid walking across
the stage. And right, so what we want to finish was, what are you most looking forward to as you start your career?
Just helping people get back to their full potential. And for like in the hub specifically, just really building into my role as a sports rehabilitator, which I've already started doing from when I started here. But just really developing my skills and building into just
getting stuck in. If people remember one thing about this conversation, would you want it to be? What one thing would you want people to kind of remember? So it can be about anything. It could be about a young person watching this at the start of their career, or it could be about an injury. It could be whatever it is. What thing would you want somebody to take away?
Like sports rehabilitation just for an athlete or
Can be fit anything.
anyone that needs help with a sort of injury or their pain, or just want to get back to that
Moving.
able to move for anyone.
Amazing. How can people book in with you or find out more about working with you?
So they can phone the clinic and they'll either get through to Louise, or if Louise isn't in, one of us, and we can sort of chat to them about what they're needing and send them in the right direction. Or we've got our website which takes you through a good pathway of
that there.
What you're needing, what you're looking for, and will help direct you towards the right clinician.
Amazing. So hopefully this has made you kind of think a wee bit. As said, it's definitely a title that most people wouldn't think about. Like, I've got an injury, I'm going to see a sports rehabilitator. So hopefully now, if you hear that term, I'm going to, I'm going to look up a sports rehabilitator. Check that they're Bas Rat. Am I saying that properly?
Bas Rat.
Bas Rat, British Association. Nothing. Check that they're Bas Rat registered, and get yourself booked in, because it might just be the difference between somebody who's really focused in on MSK health rather than somebody that maybe just does it a wee bit, that is not really their specialism. And actually, a sports rehabilitator, that is completely their bag. That's exactly what they do. So if you're struggling with just even daily tasks, pain, knee pain, hip pain, back pain, you're, maybe get an injury with golf or whatever it is you're doing, think about seeing a sports rehabilitator. And Emily's here in the hub. You're mainly East End, West End. You're in all of them, aren't you?
I'm not really
Heading
hard
hard.
just now, but
Yes.
mostly East End and West End.
Well, fantastic. Thanks so much, Emily. We'll see you next time.
Thank you.
Bye. Well done. That wasn't too bad, was it?
It was just getting over trying to ignore the camera.